Hey brother, where you going? Heading for a Galeazzi fracture. But I thought we will be doing only Monteggia fracture. Yeah, but whatever. Fuck you.
Okay, so my part of the job is done. Now it's your job to let me know what did you just witness, like what just happened. So that okay, hold on. Let me just remove these both pieces of shit and let's talk. Okay. Perfect. So now let's bring in both the personalities. So these are the pictures of Sir Monteggia and Sir Galeazzi. It might help in better remembering. So let's start with the definition. So in Monteggia fracture, this is a fracture of proximal 1/3 of the ulna and dislocation of the radial head at the elbow. And for the Galeazzi fracture, we have the fracture of distal third of the radius. Distal means far away, along with the dislocation of the radio-ulnar joint. So your joint is involved. Let me just highlight the important stuffs and then let's quickly summarize. So we have the Monteggia fracture, which is like this, and we have the Galeazzi fracture, which is like that. Pause for a moment and go through this. Next is mechanism of injury. So Monteggia and Galeazzi. By this time we know what is what. Hopefully there is no confusion. So basically what happens is, like in most of the you say clinical anatomy in the anatomy textbooks and in the orthopedics, I have noticed like in case of arm injuries, there is something called as fush injuries, that is fall on outstretched hand. So most of the injuries are due to because of this fush injuries. So let's go into more details and understand how these things happen. Now, as you can see that there is something written in the green. It tells that axial loading results in shortening of the radius. Now, what is axial loading? Axial loading is nothing but whenever the person is falling down. So let's suppose that fush injury, they fall on outstretched hand. So there is an impact. There will be a sudden impact, or the force is so much that it tends to shorten the radius. Now the radius is a rigid bone, it cannot be shortened, so what happens? It cracks. It cracks where? It cracks in the distal 1/3. And because of this axial loading, there is also a certain amount of tilt. As you can see in the black arrows, it says that there is disruption of the distal radio-ulnar joint. And because of this tilt, and why is the tilt? Because of the fracture and the impact force. This tilt disrupts the distal radio-ulnar joint. Hence, this is the classic Galeazzi fracture, that there is distal 1/3 fracture of the radius and there is tilt or disruption of the distal radio-ulnar joint. Then in the lateral view you can see that there are two classic positions, supination and pronation. So in case of supination, when the person falls, his palm will face towards upwards. So if the axial force is applied in this position, the radius gets pushed forward, which causes ulna to dislocate towards the palmar side. Okay, so that is called the volar dislocation of the ulna. And in case of pronation, here the palm will be facing downwards. So in this case, the axial loading pushes the radius backward and the ulna dislocates dorsally or towards the wrist. But notice something interesting here, that the ulna blocks the radius from moving properly. Okay, that means the ulna is blocking the radius to move. Now if the radius is unable to move, so what will happen? There will be dislocation of the joint. So that's why joint dislocation is more likely in this position. Okay, so this was about the Galeazzi fracture. Now let's talk about the Monteggia fracture. Although the mechanism is not so much of a different from the Galeazzi fracture, but it's same, like there is force transmission through the radius which causes the radial head dislocation, and whatever the impact or the force felt by the bone, it is all transmitted through the ulna, and if the ulna is not able to bear that stress, it fractures. So the fracture is on the proximal 1/3. Okay, so this is proximal 1/3 where there is that's it. Moving on to clinical features, here there is nothing much except for few things that I have highlighted. So it's pretty usual that there will be pain and swelling in both the sides, either you say Monteggia or Galeazzi. Then there will be visible deformity in again both the sides. So in the Galeazzi fracture, the deformity is termed as bayonet deformity. That's you can see here there is a soldier holding a gun, and there is a bayonet, that knife hold at the top of the gun. So this bayonet deformity is something like dinner fork deformity that is usually seen in Colles fracture. But Colles fracture is different, and this one is different. In Colles fracture, there is no dislocation of radioulnar joint, but there is only fracture of distal, like more distal than the Galeazzi fracture. And this side here, so this side we also have the posterior introitial nerve palsy, that is the nerve coming from the radial nerve. So if there is any damage to this part of the nerve, it causes wrist drop. So that's basic first year. Now let's talk about the piano key sign. So what is it? It's a very classic sign for the Galeazzi fracture. Have a look. Read the third point. Here, a positive piano key sign is when the ulnar head springs back into the position like a piano key when forces are released. So pressing the dorsum of the ulna with one finger elicits pain at the distal radio-ulnar joint. So that's it. That is the piano key sign. Alright. Next we have is the classification. For the Monteggia fracture, it is called as Bado classification. And for the Galeazzi, we don't have such named classification, but there are two types. One is volar and the other one is dorsal. So let's talk about the Bado classification first. So here we have 4 types, okay, 1, 2, 3, 4. So the types are designed in a way according to the displacement or the dislocation of the radial head. Why? Because in Monteggia fracture there is radial head displacement, right, along with the ulnar fracture. So yeah, in type 1 we have the anterior displacement. Anterior displacement of what? Anterior displacement of the radial head. In type 2 it is posteriorly displaced. In type 3 it is laterally displaced. And in type, this is important, in the type 4 both ulna and radius gets fractured, as you can see here. So this was about the Bado classification, and you can also go through the ulnar fracture pattern. So next let's talk about the Galeazzi fracture. Here we, as I have already said, it is of 2 types. One is volar displacement, the other one is dorsal displacement. So in case of supination, the ulnar piece is displaced anteriorly or volar side, and in case of pronation, it is displaced dorsally. So the dorsal one is more common compared to the supination one, and the reason being because when the person is falling down, the mechanism is fush, again fall on outstretched hand. So when he falls with his hand pronated, so that's when the dorsal displacement happens. X-ray. In this screen, we will not discuss all the things here because this is just the repetition of whatever we have discussed till now. So we will discuss only few important aspects, like in Monteggia fracture there is something called as McLaughlin's line. As you can see here, this is a straight line passing along the longitudinal axis of the radius, and it passes right through the center of the capitulum. Alright, so this is also called as radiocapitellar line. Now, in case of Monteggia fracture, just because the radial head displaces, so don't you think this line will also be displaced along with the longitudinal axis of the radius? So because of this, the line will not pass through the capitulum anymore. So by this we will understand ki, okay, radius is displaced from its normal position. So that is the importance of McLaughlin's line, that is in the Monteggia fracture. And in this point it says always get AP and lateral view of the forearm including the elbow joint. Now why is that important? See, the Monteggia fracture involves both a fracture of the ulnar shaft and a dislocation of the radial head. So the radial head dislocation that can be easily missed if we don't get both the views, that is AP and lateral. So just because of this reason we have to get both the views, and that alignment can be checked by the McLaughlin's line. Okay, so that was about the Monteggia fracture. In the Galeazzi fracture, again it is the same thing. Fracture of the distal radius you will see, and widened distal radio-ulnar joint. Classic Galeazzi. And that's all. That's pretty much it. Tomorrow I have my combat internals I mean the end postings, and then I have my orthopedics internals. So that's all. I'm not extending it anymore. Bye.